Kroschel.
And I'm Erica Freda. We're going to get a check of your midweek forecast in just a moment. But first, while you were sleeping, negotiators failed to make a deal between Anthem Blue Cross Blue Shield and Common Spirit Health.
Of course, thousands of you impacted by this potentially, and negotiations, they will continue later on this morning. In the meantime, a lot of questions for patients right now.
Kayla Henderson is joining us live from St. Francis Hospital. Kayla, you've been making a lot of calls this morning trying to figure out what this means.
Yes, I have, and I have some update. So they're not canceling appointments based on their health insurance, based on your health insurance provider, but you should contact Anthem Blue Cross and Blue Shield ahead of time before coming to your appointment. I did speak with the communications director here at Common Spirit Health, and there is no agreement just yet. But if you take a look at your screen, the director says, a quote, "Our discussions with Anthem will continue this morning, and we remain hopeful we will reach out a responsible agreement that protects the high quality care we provide our patients across Colorado. We will provide additional updates throughout the day." There is a process for applying for continuum of care, but the patient will have to prove to Anthem that it is a life-saving measure to stay with their Common Spirit provider. Common Spirit says Anthem's reimbursement rate offers have been too low, and the hospitals that are being impacted are Penrose, St. Francis, Woodman, and Interquest locations.
That affordability, again, is the key here for what Common Spirit's asking for. What they're asking for is well above the rate of inflation, and our members just can't absorb that. And on behalf of our clients, we're negotiating this for them.
Can we provide care and get a rate that's going to help us with inflation that everyone is battling? So if we can't get a rate that's really around that inflation rate, that becomes problematic for preserving the care that we have for our patients.
And according to Anthem Blue Cross and Blue Shield, members who need to find a different in-network provider, you can do so by calling the toll-free number on your member ID card.
And of course, Kayla, it's not just the big hospitals. We were looking up the list of all the other locations for just like common everyday office visits.
Yeah, just primary care providers, clinics that are all part of this. So those are impacted as well.
Yes, and I also reached out to the primary care clinic. They didn't answer; it was closed. But I keep providing you updates with information.
All right, we'll get back over to you in just a few minutes. Of course, still making a lot of calls on this as we're trying to kind of figure out, with so many moving pieces, what it means for patients this morning.
All right, we want to get over to meteorologist Brady.